Hi, hi, good afternoon, and thank you so much for joining us. This is Dr. Prince Bewa, and this is Hills Academy Risk Adjustment Made Easy, the Medicare Advantage kind. Our first live Q&A, monthly live Q&A, and we thank you for joining us. If you're joining us on YouTube or you're joining us from on LinkedIn, thank you so much for joining us and learning with us over the last month. I know we've been going over several topics regarding risk adjustment and learning what risk adjustment is and its implications for several stakeholders. And I know this might be new content to many people, so I appreciate learning with us. And it has been a wonderful time studying together, and that we have received questions coming in. And today is our first live Q&A, so we will take the opportunity to go through the questions that have been coming in, and we appreciate the time. It's going to be 30 minutes. It's going to be recorded, and it will be posted onto YouTube after the live Q&A. So we appreciate you if you're joining us live, or we also appreciate you if you'll be joining us after it's posted on YouTube, and you are watching us after that. So just again, this month we've been learning a lot about risk adjustment, what it is, and what are its implications to several stakeholders. And it's very timely to see a report that came in from OIG, came in yesterday from the OIG, the Office of the Inspector General, that touches on um, managed care and their level of work that's going to go through it. And I think I'm going to show just some pages here, and it shows the importance of what we are doing now. This is oversight on managed care, Medicare, for Medicare, Medicaid. And before that, well, I'll just go through so quickly and pinpoint some stuff in here, and then I will go straight to questions that we've received over the month. But just pinpointing the importance of learning about risk adjustment now and its importance in the work of the Office of the Inspector General. And they touch on how there are a lot of enrollment in managed care, either in Medicare and also in Medicaid, and the spending that our health system, taxpayers' money is being used for in our health system. Um, but one quick thing that I wanted to point out here touches on the risk adjustment and their work, the OIG's work, and it touches up here where OIG is touching on payments to plans and providers, and then OIG focuses on risk adjustment. So those based on risk adjustment. Risk adjustment provides higher payments to plans for individuals who are sicker, with the goal of accurately paying plans to provide services for their enrollees and prevent cherry picking. However, there is a risk that plans will misrepresent the health status of their enrollees to make them appear sicker than they are, and plan payment to providers and to improper could be improper and at risk of fraud, waste, and abuse. Although costs associated with improper payment from plans and providers may not pose direct financial risk to the government, these costs could be passed along to Medicare and Medicaid in future years if it's not identified and corrected. And it goes on and on. But this really emphasized to me the importance of what we are doing right now at Hughes Academy, educating the public about educating the health system, risk adjustment innovators about risk adjustment in our health system. So this emphasized what we are doing is very important and is much more needed in the years and now and in the years to come. So thank you for joining us. And without spending much more time, I will go into the questions and then go through some of things, like if you haven't downloaded our signature gift, if you haven't signed up, You go to our website and then you can easily sign up to get our gifts, get subscribed on YouTube, and also sign up and you'll get our monthly or our weekly information that we send out with the videos and much more information as we develop these curriculums. So thank you. We'll go straight to our questions that we have received over the month. Um, on what we've covered. So the first question that came in, I think it was from video number 1, what is risk adjustment, was that with the example given with Mr. Clark and Mrs. Jones, the examples given, does that mean the lower the risk score, the better? Does that mean the lower the risk score, the better? And this question, one thing I know I put answer in the comments on the YouTube quickly, but I wanted to pick it up here because it's better, because I can explain it better here. So I will first think through this. Is it better for who? Is it the lower the risk score, the better for the health plan, the better for providers, the better for beneficiaries or the patient, the better for who? And we can take several scenarios to look at it. Like as a patient, the lower your risk score, the lower likelihood of costing in the next year, right? That's what we've explained, your associated cost. So that might be better for the system because now you have a lower likelihood of healthcare costs, right? But a health plan who depends on revenue from there, if someone has a higher risk score, right? And then the client gets money in the context of Medicare Advantage risk adjustment. The plan gets money, higher risk score, the plans get money, and then the person doesn't use services, right? If the person doesn't use services, then the plan just has all the money as profit, right? But if the person uses much more services, although the person might have a larger risk score, but the person used much more services than anticipated, then you get a loss. So it's dependent on where you're looking at it better. It can be better for providers, likewise better for the beneficiary. So I'm supposing that it's better for the beneficiary. So if you're a beneficiary, your lower risk score, you are likely to cost less. So I guess that is better for you because you are not as sick and you don't expect it to cost more. But risk adjustment helps in fair payment. So I hope this answers your question that came in. If not, you can always reach out to me. The next question that I have here is, how does risk adjustment differentiate from traditional payment models, and why is it particularly important in Medicare Advantage landscape? So traditional payment, and I'm assuming here it's referring to fee for service. So fee for service is you receive a service, you pay. You receive a service, you pay. So you are being paid. You make a payment based on the fee that you get. So based on the service that you get. The disadvantage of fee for service, which it's widely talked around, is there's not much in value, right? Not much talk about value. So if a provider provides a service and the service didn't provide that much value to the patient, you still pay for it. So because service was provided, you have to pay. Risk adjustment, on the other hand, because it's used for calculating monthly capitation payments, helps in taking a budgeted amount and then using that budgeted amount to take care of a person. So if there's value created, if you take care of the beneficiary, the patient well, then you get a chance to keep the profit from, or the difference in how much is budgeted for and how much was used. So as compared to fee for service, where it's not dependent on value. So I'm hoping this also answers the question. And also, without risk adjustment, there is not that much of fairness. And that goes on the third question that I have here. Could you explain how risk adjustment process ensures fairness in payment by accounting for various factors that influence healthcare costs? And there are example, I think, the video number 2 and 3 using Mr. Clark and Mrs. Jones. talking about the differences in their diagnosis and their demographics, how old they were, where they live, what diagnoses, conditions that they have. So without risk adjustment, where the payment, capitated payment, is calculated with that in mind, where there can be there is potential for cherry picking, right? A plan will only choose people that are um, low in risk. They are low in risk. Their health conditions are not ridiculous. They are low in risk so that they can benefit from it. Otherwise, um, people that are high risk will not get that much of enroll. They will not be picked, so they will be cherry picking. But because of risk adjustment and plans are being paid based on um, demographics and diagnosis, or some of these healthcare cost determinants, you high risk, you get fairly paid for the high risk, and low risk, you get fairly paid for the low risk. So that's how risk adjustment helps in ensuring fairness in the payment by accounting for the various factors that influence cost. The next question that I have here is, given the emphasis on comprehensive documentation for accurate risk adjustment, how can medical coders ensure they are capturing subtle health conditions that may not be immediately apparent? Um, Medical coders, as we talked about, are coding what providers wrote down, right? Documented. So if there are some subtleties that needs to be coded to some specificity, then it is dependent on the documentation that the providers, it's dependent on the documentations that the providers write down. And also making sure that the coders are trained, well trained in risk adjustment, so that they are able to also see um, what is needed to be coded based on what is written as well. And some of this comes in some of what we are doing here, helping people understand risk adjustment so that they have that in mind. So the coders code based on what providers write down. So having the providers understand and write and document correctly, accurately, completely is needed for the coders to also code completely accurately as well. The next question that I have here is, could you shed light on the role of technology solutions providers in the risk adjustment process and how they ensure the accuracy and timeliness of data submission for optimal payment calculations? From the video, we touched on the fact that many of these work is now electronic, and technology solution providers are providing solutions in terms of documentation, in terms of the coding, in terms of data submission from the providers to the health plan, from the health plan to CMS, from CMS, and reconciling data from CMS to health plan, from health plan to providers, and back and forth. So technology solution providers, as they develop solutions for example, submissions, understanding what CMS needs, what is submitted, what is not submitted, what is rejected, what is accepted. Plans do not get paid on data that is in their systems, right? They get paid on what is submitted and accepted. So technology providers can help in that process because they make these things efficient, understanding what is accepted, what can be rejected from the CMS standpoint, and putting that in their solution so that they can better streamline data as it goes to CMS and back, and also reconciling that can help in using technology solutions to augment the people that are doing the work, the providers, the coders, and even for fraud, waste, and abuse, because technology solution providers can help with that as well. The next question is, with the complexity of healthcare systems, could you elaborate on the strategies fraud, waste, and abuse investigators employ to detect subtle misrepresentations in risk adjustment data? I'm not an investigator, so I will touch on based on even what I shared earlier regarding the work that the OIG, and I'm pulling back here again um, from what was published yesterday. And if you haven't, if you're you're in risk adjustment world and you haven't looked at this, it's 11 pages. It's very simple to read. Please, I would recommend you go back and look at this very well, because the website, dedicated to this, because it has much more information and has a list of all the um, fraud and waste and overpayment reports that OIG has put together. It's very comprehensive, and I really I think I want to give OIG kudos for such an extensive work. But most of their work, you look at the reports that they're pulling together, they have methodologies in there that one can look at, and look at some of the subtleties that are being seen in these work. So I that would be one of my recommendation as you look into the fraud, waste, and abuse questions that come up. The next question that I have here is, considering the intricate web of risk adjustment, how can healthcare providers optimize their practices to ensure accurate coding, comprehensive documentation, and appropriate reimbursement? I think one of the areas, and technology can help optimize that, but also with understanding, like having a better understanding of risk adjustment and the processes that are needed during fraud, waste, and abuse, or overpayment, or RADV, which is the risk adjustment data validation. The source of truth is the medical record, right? So, from a provider standpoint, I know many times the plans are submitting data to CMS, but at the end of the day, it's CMS, it's data that they got from data that the plans got from the providers. So a provider having a very end-to-end understanding. I know providers have a lot on their plate. Even the practice managers or someone having an end-to-end view, understanding is helpful, so that you know that the data you're submitting to the plan um, is not just going to end there, but the plan's going to send to CMS. CMS is going to do some work on it, and that's going to translate back to the money that the plan gets and back to the provider. So having an end-to-end view that way will help providers work with their practice managers or to find an efficient ways and optimized ways to help with and also augmenting with technology to help develop ways that the data I'm sending to the plan, will be accepted by the plan and is fit for CMS. And therefore, it makes the data flow timely and complete with completeness, accuracy, and timeliness, and back and forth. And it prevents a lot of back and forth with data. The next question I have here is, given the dynamic nature of healthcare, how do healthcare stakeholders stay updated on evolving risk adjustment methodologies and regulations to maintain accuracy and compliance? This one, CMS publishes risk adjustment information on the cms.gov. There's also the cssc.gov, the HPMS website, and there are several avenues that CMS publishes information. So there are listservs that you can subscribe to, and I would recommend anyone working in risk adjustment subscribe to these listservs so that you stay updated. But a big one is the CMS website. You go to the risk adjustment page, Medicare Advantage risk adjustment page, and it has the policies, the annual payment notices, and during the year there's HPMS memos that go out during the year. So that's another area that you would want to stay abreast and register on the listserv so that you are able to get the information that you need to stay updated. The next question I have here is beyond financial considerations. Could you explain how a deep understanding of risk adjustment um, translate into more informed and tailored healthcare services for beneficiaries? So risk adjustment helps with getting the necessary resources into for this one monetary resources to take care of the beneficiaries. And that is another area that you will see in the OIG's reports in terms of getting the money but not taking care of providing services that are pertaining to that the beneficiary needs. So making sure that you have a better understanding and not only understanding of risk adjustment as a concept, but also a better understanding of the processes, because just an understanding and it involves a lot of data back and forth to be able to get um, your data to CMS accurately, timely, completely, in order that whenever CMS is doing the runs and the reruns and everything, you are able to, the data is needed at that time is there, so that you are able to get the money that you need for um, for for to take care of the beneficiaries. So that is a way to keep abreast on that. Question I have here is, in the context of risk adjustment, how do healthcare policymakers strike a balance between promoting fair payment systems and encouraging innovation within Medicare Advantage programs? I think um, promoting fair payment systems, risk adjustment is one of the methodologies that is being used, and even within the risk adjustment context, that's why there are payment changes all the time, or many of the time, and CMS is making payment changes based on information and learning and knowledge. At first, RAF's data was being used. Now, encounter data is being used as part of the innovation and the learning. So, as at the end of the day, CMS is making sure that payment is fair and accurate as possible, and also even within that, in submitting data, um, in reconciling data, in getting payments out to plans on time. All these are innovations that are going that goes through, and whenever there is a change, there's an opportunity for innovation. So all these are processes that help with risk adjustment and also help with innovation in the industry. Um, the next question I have here is, in the context of risk adjustment. Okay, I think I read that. Could you provide insights into how technology solution providers ensure the accuracy of risk adjustment data submissions across various health plans with different beneficiary populations? Um, I think understanding the requirements, the data submission requirements as a technology vendor, and working and the strategy of having the end in mind. What does CMS allows? What does CMS accept? And with what is accepted, what is rejected, knowing the algorithms around that, then as a technology vendor, you can have some of these things um, go through some filtering process, or triaging process. As providers or plans, you work with providers and plans to submit data to CMS. Having those ahead of time to look at the data to help resolve issues before submission, and also this is based on timeline. So you want to make sure that these are submitted on time, timely, and having these things help to triage data submission to CMS. And I think as a technology vendor, even in coding, right, or even in documentation, inscribing documentation, these are all helpful to make the work of the providers easier, the coders easier, the submission process easier, and getting the data to CMS on time. The next question that I have here, we have only 5 minutes left. With the data submission process being crucial, how do health plans validate the accuracy of information shared by providers before it's sent to CMS and counter data systems? Um, How do health plans validate the accuracy? I think ultimately is the provider's medical record as the source of truth. Even in the risk adjustment data validation process and with the OIG's reports, the source of truth is the medical record. So for health plan, it will be more of making sure you align with the provider, and with that alignment, you are able to work with the provider to get the data in an accurate, as accurate as possible. And with an accurate data, you are able to submit to CMS. So it demands collaboration between health plans and providers, collaboration between the health plans and providers to be able to have accurate data sent to CMS. Question number that I have here, I think it's like question 16. Considering the potential for misunderstanding, could you explain how the healthcare system prevents unintentional errors in the documentation and coding process, thereby maintaining accurate risk adjustment data? I'm not a medical coder, but what I can add on is that it comes from the provider documentation, right? And then as providers document, so any technology that can augment, only processes that can augment providers to document well, make their lives easier documenting, and also helping with the coders doing the medical coding, can help with this risk adjustment data process, as we have discussed earlier. The last question that I have here that I'll go through is, how do healthcare organizations optimize their resource allocation and care planning strategies using insight derived from risk adjustment data? And what impact does this have on patient outcomes? So optimizing resource allocation and care planning strategies, I think the risk adjustment is a payment model, but at least it is based on clinical diagnoses. So knowing, and I use Mr. Clark and Ms. Jones' example in the learning series, knowing what drove their risk score at least gives some insight into what can be done, what is the need out there. And not only, I know not all diagnoses map to HCCs that map to risk score, but at least that gives some idea that a health system can start thinking through and allocating resources that they can provide care for those beneficiaries. That will also help with the patient outcomes as well. So these are the questions that that appeared from this series, and thank you so much for joining us again. And we thank you. I know we've been learning throughout the month, and if you're new to you're new to Heals Academy, Risk Adjustment Made Easy, welcome. And I want to emphasize again that the resources are on our website, thehealsacademy.com, and you can always download it and watch the videos and learn more. And you can reach out to me on info at the Heals Academy, TheHeals Academy.com. And we are glad that you joined us today, and we thank you for joining us to learn. And please feel free to subscribe, feel free to share, feel free to to send the information to anyone who can benefit from this. And thank you for joining us today, and see you next month, which is tomorrow, and next week, which will start on our new monthly learning series. And thank you for joining us again. Bye-bye for now.